and hope that somebody continues those questions.
Dr. Bessler.
In my opinion, acceptable health care insurance coverage is catastrophic coverage, not first dollar coverage or low deductible, low copay insurance. The principle of insurance is to protect the insured from a financially overwhelming expense. The purpose of insurance is not to cover expenses within the insured's ability to pay. Therefore, high deductible catastrophic insurance tailored to the insured's financial status is both appropriate and less costly. Catastrophic insurance that picks up after health savings account, also originally referred to as medical savings account, where it cuts off, the catastrophic picks up. None of this requiring a whole redo of our healthcare system.
Dr. Thompson.
I completely concur with Dr. Is it working? Hello?
We need a hot mic over here for Dr. Thompson.
Hello? Okay.
There we go.
Well, I completely concur with Dr. Bessler. In fact, I think he was reading my notes. Seriously, I think, and Gilly also mentioned this as well, with catastrophic insurance, that's got to be the mindset. You know, you start thinking about other forms of insurance that you have, and you certainly think of auto insurance. You know, do you go in and make a claim when you get, you know, you find out that your wife has put a little ding in the side door? No, you know, you don't. It's not worth it to you to file that claim unless you are willing to pay out the wazoo on various insurance. So I think that same mindset has to be taken with health insurance. You know, to what degree do we need to put the burden back on you as the consumer and the patient to say, this is what's important to me, this is what I value. Yes, I now need to go see a doctor because this is something that's important, and I have the money that I'm going to spend for this kind of treatment. Insurance should be there when you have something major that's unforeseen, that is catastrophic, they're life-threatening, that you need that support and that help to step up and help pay and finance those costs, but not for just your day-to-day healthcare living and daily needs. So,
Dr. Scioli will wind up this question.
Well, I think you pretty much know where I stand on this, so I'm going to tell you a story. And this is a real-time story that dates back 2 years ago to a young lady who at age 30 was involved in a motor vehicle accident, and she fractured her vertebra at T10 right here, paralyzed from there down. Her husband divorced her. Her 2 children are grown. They can help a little bit. She's been put in a nursing home. She has Medicare and Medicaid. What constitutes acceptable health care coverage on the part of our already there, that you are very proud of, government payer? Let's look at this quickly. This poor lady developed massive decubiti, ulcers. She had chronic indwelling Foley catheter with chronic urinary tract infection. And she developed a florid septic arthritis that completely destroyed her left hip joint. I put my finger all the way to the bone in my office. I took her to the hospital. I resected her hip joint. We got her well. We sent her home about 8 weeks later in a brace that Medicare paid for that would hold her leg in such a way that she, with this flail hip, could be transferred bed to chair, as she is wheelchair bound. That's 2 years ago.
Looks like the acorns have rolled down the aisle again.
Now, if I could finish, so here's what happened. Fast forward to 1 week ago. She in her nursing home fell out of her wheelchair. She fractured her femur right above the kneecap. She's wheelchair bound, and what is the treatment of choice for that lady? The treatment of choice is to put her in the very same type of brace that Medicare paid for 2 years ago that I used on the opposite side. But there's a rule. You only get one every 5 years. So our wonderful universal payer does not allow this lady to have the proper treatment. You wouldn't know that sitting where you are and reading the paper and watching CNBC and Fox News or any of the other ones. That vignette does not come across. So what happens? I'm still obligated to take care of this lady the right way. What do? I call up the brace shop. I ask how much is the brace. They tell me. I pay them the wholesale cost out of my pocket. I send my staff to her nursing home to put that brace on that lady because it is the right thing to do. I would like our president to do the right thing and make sure that poor lady in his plan is taken proper care of. If he can't even help the poorest of that, then why am I going to entrust him to 1/6 of our economy? No way.
Thank you, panel. Let's hear it again for the panel. We've got a great panel here.